Hi, my name is Kelly. I'm here to do a newborn assessment. So I've come in and talked to mom. Mom is sleepy. I've introduced myself to her, told her that I need to do a newborn assessment on baby Bobby. Um, so she was sleepy, so she said it was okay for me to take Bobby to the nursery to do our assessment and then return him when I'm done so she can take a quick nap. So I have all my supplies. I'm going to go ahead and sanitize my hands. So a little bit about baby Bobby. Bobby was born vaginally about 8 hours ago. Bobby is Caucasian. Bobby is kind of sleepy right now. So I'm going to go ahead and put on my gloves. So again, baby Bobby is Caucasian male. We're going to look at his general appearance. I'm going to go ahead and uncover him. Alright, so Caucasian male, born 8 hours ago. Skin looks good, nice and pink. Like I said, his posture, he's kind of sleepy. So he is relaxed. His arms are flexed at the elbows and cubital space, and knees are flexed. Um, Looking at proportion for Bobby, his head is about 1/4 size of his body, which is correct proportion from head to body size. And for movements, when we touch on baby's body moves proportionally and equally. Each side equals or moves bilaterally equally. Skin looks good, no signs of stork bites, no abrasions, no bruising, no signs of trauma from delivery. When baby Bobby was born 8 hours ago, his weight was taken and he measured to be out 32,000 or 3,200 grams, so 3,200 grams. Range that we were looking for, so for weight would be 2,500 grams to 4,000 grams. Is good. We're going to go ahead and measure his length. So I'm going to get my measuring tape here. And we're going to measure from the top of his head to his heel. We're going to make sure he is nice and straight and straighten out his leg. So his length comes out to be 50 centimeters, which is good. And for a average length, we want to see about 48 centimeters to 53 centimeters. Next, we're going to go ahead and do our head circumference. We're going to lift up a little bit on his head, make sure we give him good support. And then we are going to do this right at the eyebrow, right above eyebrow level. And his head circumference looks good at 34 centimeters. And what you're looking for is between 32 and 36 centimeters. Our next measurement is going to be the chest circumference. So we're going to go underneath. And what we're looking at here is at the nipple line, we want to be between 30.5 centimeters and 33 centimeters. And Bobby measures at 32 centimeters. So his measurements look good there. Next, we're going to move on to respiratory. So for our respiratory rate, we want to listen, or not listen, but we're going to feel for a full minute. So there's two techniques that you can use. You can use observation or hands-on. I'm going to do hands-on. So I'm going to place 2 fingers here, and we are going to feel for a full minute. And the rate that you want is between 30 and 60. All right, like I mentioned, for respiratory rate, you want between 30 and 60 breaths per minute, and Bobby, we got 36. So respiratory looks good. All right, next we're gonna go ahead and just talk about signs of respiratory distress. So 6 signs that you can look for would be circumoral cyanosis, which is blue-gray around the mouth. I don't see any of that. There is no gasping, no grunting, no nasal flaring, and no tachypnea. And on each breath, chest rises symmetrically, so no asymmetric chest rise. So no signs of respiratory distress for baby Bobby. And then next we're going to grab our stethoscope and we are going to use our pediatric stethoscope to listen to his lung sounds, his breath sounds. And we use the pediatric stethoscope because the size is appropriate for our patient. We want to use the pediatric stethoscope because our baby is small. And also, if you were to use a larger size, then you could be listening to the wrong things at the wrong time. So size is appropriate. And then on the sides. Baby Bobby's respiratory sounds, breath sounds sound good. If he was born by C-section, his lungs would sound a little different since he was born vaginally. His are nice and clear. If he was born by C-section, then the difference would be that there's lung sounds would sound a little more junky because the mechanical factors of delivery. When baby passes through the passage, they get squeezed a little bit, so it takes out or pushes out some of that excess amniotic fluid to clear out their lungs. So respiratory sounds good for baby Bobby. So next we're going to go ahead and move on to the heart. So we're going to go ahead and listen to his heart rate. And for a newborn, a heart rate should be anywhere between 120 and 160. Um, and we want to listen at the apical site. And for baby, it is a little more lateral than mid-clavicular, like an adult. And we're going to be listening at the third intercostal space. And we're going to listen for 1 full minute. All right. Baby Bobby's heart rate sounds good at 140. The rate that we are looking at is between 120 and 160. Is good. Next, we're going to feel some pulses. So we're going to feel the brachial pulse, and you want to feel both of them at the same time equally, just to make sure that they are not different on either side. So we're going to feel for rhythm, rate, and strength. And for brachial, we feel equal, normal at 140, and I'd say about 2 plus. Next will be the femoral. And again, rhythm, rate, and strength feel equal, normal, 140, 2 plus. And those feel good. We're not going to do a blood pressure on baby Bobby. On newborns, you don't typically do a blood pressure unless there is a sign for a cardiac problem. If you did do a blood pressure, your systolic should be between 65 to 95, and diastolic should be between 30 and 60. Next, we're going to move on to Bobby's head. And so for his head, we just want to feel for the suture lines. And the suture lines should be soft and palpable. And then also you want to feel the fontanelles. So the fontanelles, there are two fontanelles. The anterior fontanelle is the shape of a diamond, and then posterior, which should be shape of a triangle. And Bobby's feel good. They are not flat or sunken in, which would be sign of dehydration. And they are not bulging. If there was bulging at the fontanelles noted, then that could be sign for intracranial or increased intracranial pressure. Excuse me. For looking at his head, we also want to look for any signs of the caput succedaneum, which is there from birth. What this is swelling of the head, and this is a result of the head pushing up against the cervix for an extended amount of time during labor. Again, this could be totally normal. It would cross over the suture line, so it would typically be a larger area. If this is noted, it just takes a few days after delivery to go away on its own. Baby Bobby was born 8 hours ago, so we should not notice any cephalohematoma. However, if he was born 24 to 48 hours ago, then we could note it. And what that is, cephalohematoma is swelling between the skull and the scalp, and it does not cross suture lines, so it could be across the front. But not crossing any suture lines, could be on the sides or on the back. If this is noted, it can take weeks to months to resolve. But again, we don't notice any of the cephalohematoma on Bobby because he is only 8 hours old. Looking at his eyes are gray, which is normal. His sclera is nice and white. No signs of jaundice for baby Bobby. Babies cannot see very well at this age, so we can check pupils to a certain point. So we're going to go ahead and see that his pupils are equal. All right, so for what we can see at this stage, Perla looks good. Next, we're going to check his ears. So what we're looking at on the ears is the tip of the ear, which is called the pinna, and we want to make sure that that lines up to the outer portion of the eye, which is the outer canthus, and that looks good for baby Bobby. We also want to look for any pre-auricle skin tags, and those would be, if they are noted, they are indications for possible kidney abnormality or hearing problem or a chromosomal defect. So the ears and the kidneys develop at the same time in utero. So that's why there could be a correlation. But Bobby looks good. Next, we're going to go ahead and check the nostrils. So we're going to check for patency. So what you want to do is just push up slightly on the chin so that we can close the mouth, or you can just kind of push up on the bottom lip. Then with one finger, you want to close one nostril. With the finger from the other hand, you want to just place it underneath the nostril to feel for airflow. Feels good. And then we would just do opposite side. Feels good. So normal nostrils, patency feels good. We can feel airflow out of each side. Excuse me. We're going to go ahead and check his mouth. So you can check for the rooting reflex, which would just be placing your finger to the side on the cheek. And if you do that to one side, then baby should follow it to try and root. You can also check the sucking reflex. If you put your finger just slightly in the mouth, baby will start to suck on the finger. We're going to look at the symmetrical shape and movement of the mouth, and baby Bobby's mouth moves equally. If there was any one side moved differently, then that could be a sign for injury to the facial nerve. Excuse me. While looking in the mouth, then we can also see if there was any obscene pearls, which is some white patches. I don't see any of that. Again, we don't see any of the circumoral cyanosis, which would be the bluish gray around the mouth, and that would indicate low oxygen levels, which could be respiratory distress or heart defect. But we don't notice any of that for baby Bobby. We're going to move on to his neck, and so neck should be nice and short, but you'll notice some thick skin folds, and baby Bobby's neck looks appropriate. We want to make sure that his head can move easily side to side. So just gently turn. Looks good. And then we're going to check for webbing. And we want to make sure the neck is straight and not webbed out on either side. And that looks good. And there is no obvious fat pad here. We want to check his clavicle. So we're going to rub our finger all the way down each side. And what you're what you're feeling for is any abnormal lumps, bumps on the clavicle, which could be a sign of a fracture. We also want to check his chest shape, and we can see that he is shape of a cylinder, which is normal. We're looking at nipples. There are 2 nipples, bilaterally equal, within line. And then we're going to move on to our abdomen. So abdomen, we're going to listen for vowel sounds, and you always want to listen before you palpate. We'll start with the lower right. Vowel sounds appropriate. So you should notice vowel sounds within the first 24 hours from delivery. We're going to palpate the abdomen. Feels nice and soft, round, and symmetrical. We're going to check the umbilical cord. Don't see any bulging for the cord area, which would indicate a hernia if there was. The cord, you sometimes can see the arteries in the vein. So if you can see, it would be 2 arteries and 1 vein, but over time it does get darker, so it's a little harder to see. So I don't see any abnormalities with Bobby's umbilical cord area. So next we're going to move on to extremities. I'm going to go ahead and check the Moro reflex. So I'm just going to slightly grab each hand. We're going to lift baby up just a little bit so baby's head drops back a little. And then we're just going to gently release. And this makes baby kind of fall back. And as baby falls back, baby gets startled. So arms wave out. So that is normal. And then we're going to check for hip dysplasia. So we're going to check both legs at the same time. We're going to gently push up and then rotate out. And we're listening for any click. I don't hear any clicking, so that sounds good, looks good. We're going to go back to the hands. We're going to check the palmar reflex. So the palmar reflex is if you push your finger into their hand, then they will grasp onto it. Bobby feels good there. We want to note the crease lines in the hands. There should be multiple creases. That looks good. No seaming crease. And then for ankles and feet, we want to check for toes. There is 10 toes, no webbing. We've got 10 fingers. And then we're going to check reflexes on the feet. So the plantar grasp, if you just kind of, you can either rub here or push slightly into the top of the sole of the foot, and the toes will kind of curl inward. That looks good. And then Babinski, just kind of roll up and across, and toes will flex outward. And that looks good as well. Next, we're going to go ahead and move to the back assessment. So we're going to support baby Bobby's head. We're going to roll him over and then pick him up. And so for back, we want to make sure that back is nice and flat and straight. And we don't feel any abnormality there. Baby Bobby's back is straight, is flat. I don't notice any tuft of hair here at the bottom. If we did notice any tuft of hair, that could be a sign of spina bifida. Also, there is no dimpling noted at the sacrum. If there was, then that could be pilonidal dimpling, which is a sign of a neural tube disorder where the neural tube did not close. So no signs of that there. We're going to check his buttocks and make sure the folds are symmetrical and equal in length. Legs are equal in length. While we're here, we're also going to go ahead and check his anus. We want to make sure that there is no signs of fissures. Those look good. We don't notice any Mongolian spots on baby Bobby's back either. So we're going to go ahead and roll baby Bobby back over and lay him down gently. Next, we're going to go ahead and check his genitalia. So for baby Bobby, we want to see that the scrotum is bilateral with testes intact. We should have 2 testicles there. And then you want to observe the penis. So for the penis, you're looking for where the urethral opening is, and baby Bobby's is at the tip. So we're looking for epispadias or hypospadias, and epispadias is where the urethral opening is at the top of the penis, and hypo is where it is at the bottom. So baby looks good on our assessment. So I'm going to go ahead and wrap him up and get him nice and warm and get ready to go back to mom. Alright, so baby Bobby is nice and wrapped. We're going to go ahead and get him back to mom. My hand hygiene. Alright, so Bobby is back to his mom. We're going to make sure she is good. We're going to give her a call bell and answer any questions for mom before we leave. Thank you.